Just a year ago, 3 Hudson County hospitals were on the verge of collapse, buried under millions in debt without a lifeline to save them. Well, today marked a dramatic turnaround with the ribbon cutting of a rebranded system that's now the 4th largest health network in New Jersey. So how did it get there? Senior correspondent Joanna Gagis reports.
Today, we're here to celebrate the unveiling and the rebirth of the old Bayonne Hospital as the new HRH Bayonne University Hospital.
Healthcare and elected leaders from across Hudson County gathered in Bayonne today to mark a new day for healthcare that some worried would never happen. 3 hospitals under one healthcare system known as CarePoint, on the brink of bankruptcy and closure, have now been reincorporated under a new healthcare system called Hudson Regional Health, or HRH.
We were this close from all 3 of these hospitals closing, this close. And it wasn't us crying wolf, it was a reality because there just wasn't enough money in the system.
The 3 hospitals that made up the system under CarePoint were Christ Hospital in Jersey City, Bayonne Medical Center, and Hoboken University Medical Center. Jan Moshe, chairman of the board of HRH, took over Meadowlands Hospital in Secaucus in 2018, turning it into Hudson Regional Hospital, the 4th hospital in the system. But each of the healthcare providers faced a similar challenge: the number of charity care patients they serve.
We have disproportionately a much higher percentage of indigent patients, of patients unable to pay in our hospitals in our urban county than others. Not only did the prior operators of this system file for bankruptcy, but more than one of the hospitals in this system were on the verge of closure. And if any one of the hospitals in this system had closed, healthcare in Hudson County collapses.
The impetus for the change was Jan Moshe investing tens of millions of his own personal dollars into the system to revitalize it from the ground up, says President and CEO of HRH, Nizar Kafaya.
Especially, services that were close to patients in communities like Bayonne here that are essential, such as the cardiac cath lab, neurointervention, stroke care, and many other areas that were lacking supplies, and therefore they were shut down. And so we started by reopening a lot of those services, making sure there's enough supplies for all the different services, stabilizing the working force. And then we started investing in creating new service lines.
These hospitals are known for the amount of charity care that they have to take on. Do you see that return on investment, especially if there are cuts to Medicaid that could end up increasing the amount of charity care patients you take on?
We all understand what area we serve, right? This is Hudson County, and unfortunately there is a large population of charity care patients, but it's not just charity care patients. There are a lot of undocumented patients. Our goal is to really invest in areas that are going to make up for the loss on the charity care and undocumented patient side, because as acute care hospitals, we have to keep our doors open. Again, we're choosing to invest in other areas that will make up for the loss on this side so we can continue to serve the community.
Now, on top of the tens of millions he's already invested, Jan Moshe plans to invest an additional $75 million into major renovations here at Bayonne, in Secaucus, and Hoboken University hospitals. They expect those projects to be completed within the next year and a half.
Our goal is to make sure that it's a very efficient delivery healthcare system that delivers good quality care efficiently to the county, to its residents. And a lot of patients come here from New York as well.
Will it be something that needs continuous personal funding to keep it going?
No, our goal is to make sure that it's self-sustainable within a year and a half.
But as someone who sits on the hospital board, Jersey City Mayor Steve Fulop offered a word of caution about the system's future.
The finances are not great. Today is a celebration as we're taking a step in the right direction. The reality of the situation is, absent of help from the state and help from the county and continued help from the municipalities, in 5 years' time, the same hospital systems in Hudson County will not exist.
It's a stark reminder that serving the healthcare needs of the community remains a challenging and costly endeavor. In Bayonne, I'm Joanna Gagis, NJ Spotlight News.